Well, welcome and happy Tuesday, everyone. Thank you to everyone who has joined us today to hear about what you can do, what all of us can do to move the administration to take action on accessible air travel. Before we begin, I'd like to just take care of a few housekeeping notes. You will have an opportunity to submit text questions to today's presenters by clicking the Q&A button down below of your screen. We will answer your questions toward the back end of our conversation, and we're really looking forward to a tremendous program. We have a full agenda today, including a discussion with ALS advocate Katie Adams and Kelly Buckland, who works for the Department of Transportation, as well as other ALS Association staff who will provide details on how you can use your experiences to move the needle on accessible air travel. But first, I'd like to introduce Colony Balazs, President and CEO of the ALS Association. Colony, take it away.
Thanks, Lance, and happy Tuesday to you too. I want to say first, thank you all for being with us today. We're really grateful that you're spending an hour of your day with us to talk about this really, really important topic. As many of you know, air travel, whether you have a mobility issue or not these days, is not fun. And if you do, it can become even worse. I know many of you have either experienced and or witnessed some of these really difficult situations, ranging from uncomfortable to downright just a nightmare. I hear frequently all the time from our community, people who experience challenges at the airports, on the planes, trying to fly for medical reasons, trying to just go see their families for the holidays can become an impossible task. So we recently launched an action alert asking what issues you run into in air travel. And we have heard from individuals from across the country who, like me, love to travel, but have also had to cancel trips due to airlines not being able to accommodate a complex wheelchair, mishandling of medical equipment, suffering injury at times, experiencing airport personnel who aren't properly trained to transfer individuals in and out of their wheelchair. And I know you believe, and so do I, that people should not be denied safe air travel simply due to their accommodations that they need. We know that addressing these concerns is something that really should be done, and Congress and the Biden administration are working to remedy this issue around air travel and try to improve it. However, their ability to adequately consider all of the different issues that the community is facing during air travel can't be addressed unless we speak up loudly, unless you speak up loudly. That's where you come in. The Department of Transportation is currently collecting comments on the public's ways, from the public on ways to make air travel more accessible. So we are collecting those stories from the ALS community through our Advocacy Action Center. And at the end of this, we'll be sending them to the Department of Transportation to ensure all of your voices are heard. Soon you're going to hear from Katie Adams, like Lance mentioned, and one of our wonderful advocates who experiences issues with air travel while living with ALS. Her experiences and your experiences can bring to light the issues to the government and really help the government take the correct steps towards offering solutions, real solutions. So again, at the end of this webinar, you'll receive an action alert that you can immediately use to share your experience and your recommendations as to how we can improve this for our community. So Lance, I'm excited to get this conversation started.
Yeah, thank you, Colony, for providing some background to this important issue. All right, now stay close. We're going to have you now speak with Katie Adams, a phenomenal advocate for the ALS community, and Rich Brennard, who is the Vice President of Federal Affairs for the ALS Association. Have at it.
All right. Welcome, Katie. Thank you so much for spending your afternoon with us, a little bit of time. I really appreciate it. And Rich, I know you're down the hall from me, but it's good to see you on the camera too. So I'm looking forward to this conversation. So we ready to dive in?
Yeah.
All right. Katie, let me just start with you, because I know you're a mom of two. So that in and of itself is a lot to navigate, right?
Yes.
And then, just the overwhelmingness of a parent and really trying to figure out, how do you get your family on an airplane trip? What's
Yeah.
that day look like?
It's a lot. It's not a day, it's several days. Um, Before ALS, I'm really OCD, so I would pack like 2 weeks in advance. And now I can't do that. But mentally, there was so much to prepare for. So I got online and did all the research I could. Um, and I filled out TSA Cares. It's a program that TSA is supposed to meet you and help you through the lines, the security lines. So I did that. On top of that, I fill out a TSA notification card, and that tells the TSA staff what disability you have. Um, and then on top of that, you have to arrive really early to the airport. Earlier than normal because you don't know how long it's gonna take to get through the security lines. It always takes a long time to get a female TSA officer to do the pat down. So that's another thing. And then everybody has a job. I assign everyone with me. All right, you're in charge of the BiPAP. You're in charge of the cough assist. You're in charge of the batteries of the wheelchair. So I go through it several times to make sure my kids or whoever is traveling with me, I make sure they're ready. And then I only feel comfortable with my family transferring me and helping me, so it's all hands on deck. Like I said, they help me get into the plane, and then they have to unfold or fold up my wheelchair. I travel right now with a portable lightweight wheelchair, so we ensure that we are the ones that fold that up and take off the joystick and the batteries and that it gets on the airplane safely so that I can enjoy the trip. So it's a lot. And I don't travel with less than 2 people with me.
That is a lot.
Yeah.
And actually really impressive. And I would be remiss if I didn't let people know a little bit about your background. So you're not just a person living with ALS. You're obviously a mom of two, as I mentioned. But my understanding is up until the day you were diagnosed with ALS, you were working as an occupational therapist and a rehab manager. So you knew a thing or two about how to handle some of these things. And I also
Absolutely.
Good. And I also just want to share that you have a bit of tenacity in you, right? Your journey with ALS has been really an inspiring one. So when you faced this denial from Kentucky Insurance for your power wheelchair, I remember the story quite well.
Yes.
And do you want to share it just a little bit before I go on
Yeah,
to the next
sure.
guy?
So yeah, I was denied, like you said, for my power wheelchair. And I spent over a year fighting with insurance to get that wheelchair. More and more of it covered. But I also, in the middle of that, went with the ALS Association to Frankfort, Kentucky, and testified in front of the Senate Health Committee to get a law change in Kentucky where people under 65 with disabilities, specifically ALS and kidney disease, could purchase affordable Medigap insurance. So I got that and I have better insurance this year.
Great. So you can imagine that Katie's not only education, but her tenacity kind of probably serves you quite well at the airport when you're dealing with things.
Oh, yes. They get tired of me before I get on the plane.
That's good. That's good. All right, well, back just a second. I'd like to turn over to Rich Brennan. So Rich serves as our Vice President of Federal Affairs for the ALS Association. And I know you've been in this business for well over 20 years. Maybe I shouldn't say well over 20 years, just over 20 years. How's that? I know you've been engaging with the White House, the federal agencies, Congress, healthcare, a ton of innovation policies. And he's also led efforts to influence the federal government affairs strategy. His efforts have contributed to the expansion of reimbursement for healthcare services, federal funding for telehealth, electronic health records, increased investment in research and value-based care. And I could go on and on and on, but I won't, because we're here to talk about travel and air travel in particular. So Rich, earlier I mentioned that, we have been seeking comments from the community. What are the challenges that they're seeing? What are the things that they'd like to see us change? What have you been hearing that you'd like to share with our colleagues?
Thank you, Colleen. Yeah, first of all, unfortunately, many of the comments that we received, as you can imagine, are comments about their frustration with air travels. And so people that face or are living with ALS face many risks by traveling by air, such as either damage to themselves, there's personal risk, as well as damage to their equipment. They also have experienced being mistreated or demeaned by airline staff. And they also suffer physical and emotional distress when they travel. So the common concern is that they're missing out on opportunities to see new places and visit family, and also participate in clinical research and even our advocacy events, unless something were to change. I don't know if you know, but this idea that indeed this is a problem is well stated. In fact, in 2023, more than 11,000 wheelchairs and scooters were mishandled by carriers, which totally underscores the need for urgent reform. And as you mentioned, we had several comments that we have. In fact, anybody who's joining this webinar today, we invite to comment. We'll be collecting those comments and sending them to the Department of Transportation. So it's important that we reach out to the community. But this is a summary of some of the concerns that were expressed by the ALS community so far. First of all, is damage or loss of their battery-powered wheelchairs and scooters. The fact that there's lack of training and sensitivity of airline and airport staff. They've experienced long waiting times for wheelchair assistance, missing flights, missing, the ability to get to destinations. There's been an inadequate space for them as well. And also things that are medically necessary, such as difficulty using and carrying their feeding tubes or ventilators. There is so much that somebody living with ALS has to take into account as they travel that is not part of the normal just carry-on luggage. So there's also been delays in the security procedures and policies, as they go through security, as Amy had said. So, having to show up to the airport, 3 hours ahead of time, whatever it would be, is just not being treated like any other passenger. There has to be some change in that. I would say that with that underscored, I did have a story that it's a brief story that I wanted to share, which really underscores the comments that we have so far and sort of what it's like to have ALS and be traveling. If you allow me these, 30 seconds to do this. So this is a story that we will submit to the Department of Transportation. So I'm glad that Kelly's on the line as well. It says, I was heading to Tampa Bay, eager to soak in the warm Florida sun. But as I wheeled off the plane, a sinking feeling crept into my chest. My wheelchair was nowhere to be found. Panic washed over me as I realized that I was stranded, alone, and vulnerable. The airport staff tried to assure me that they were looking into the situation, but minutes turned into hours. My anxiety soared, as I imagined all the scenarios playing out. What if my wheelchair was damaged? What if it's lost? Tears welled up in my eyes as I felt the crushing weight of my disability. I felt isolated and abandoned. Eventually, a replacement wheelchair was located, but the damage had been done. The experience left its mark on me, a reminder of the constant challenges I face as someone living with ALS. So just to give you, I guess, a brief experience of somebody's destination, just to soak up the Florida sun, turned into a nightmare.
Thanks for sharing all of that, Rich. That's a powerful story. I've heard several of them before, and we could probably tell them for days. I'm going to give you a softball question here because I'm happy on a Tuesday. You know, when you look at the impact, I mean, this is a person who was just trying to go on a vacation, right? Get some sun. Have you heard some stories on anything around impact on care delivery, or maybe trying to get to clinical trials, for example? You know, those things that really have different kinds of impact on people. I'm curious.
And thank you, Colony. There is that aspect of this that people travel for medical necessity. If there is a reason to seek care, let's say that there's an ALS clinic in a state that's outside their state and it's only accessible by air, it'd be too long for them to drive. That's a barrier that needs to be raised. If they want to participate in a clinical trial, in fact, I know one of our board members participates in a clinical trial that he lives in North Carolina. He has to come up to Maryland to receive his medicine and participate in that trial. That is simply unavailable to him to necessarily have to make that back and forth by car all the time. So there are barriers to travel that exist for people that have mobility issues and that are they have medical necessary reasons for travel. We also feel that that should be taken into account by the airlines as well, that there should be a special way of traveling and saying, I'm designated, I'm going for, medical necessity, just as if you would be prescribed a wheelchair or whatever it would be as a medical equipment. There's reasons to have it made available to everyone.
Great. Thank you, Rich. So Katie, I know you're here because you probably have had an experience you'd like to share with us, maybe when your DME wasn't handled appropriately. Have you had that kind of experience, and what happened?
Yeah, luckily I haven't had anything too major.
Good.
But I have felt the sense of what would it cost me if something did
Yeah.
happen to my equipment, and not just financially, but quality of life. I had my walker seat broken once, and luckily I don't sit on it, so it wasn't a big ordeal. But one flight, my family, my kids, my significant other, and his kids were traveling to a cruise, and we got on the plane and we're looking out the window and we see my wheelchair. And like I said earlier, we fold it up so that they don't have to. But we see it going out to the conveyor belt to be put on the plane, and the man had it open, and he was trying to figure out how to fold it. And we were watching from the window, and I'm like, oh my goodness. But because I'm thinking that is my independence, that's my comfort. If I didn't have that for my trip would have been highly spoiled. I wouldn't have been able to go where I wanted, when I wanted. Somebody would have had to push me. And it wouldn't have been as comfortable. But we're watching him, and last minute he puts it on the conveyor belt and it's open. but finally he gets it to collapse at the last second. But I felt everything that the lady in the story Rich just told. I felt all of that.
Yeah.
So
Wow.
it's scary. And now I am to the point where I don't want to travel because I need my power of wheelchair, the one that costs as much as the vehicle.
Right.
And I don't trust anyone to handle that. I don't trust just anyone to transfer me. So yeah, I'm at the point where I'm not gonna travel by plane anymore until some things get fixed.
Yeah. Thank you for sharing that. And I'm sorry you're not going to travel anymore until things get
Yeah.
fixed.
And
Yeah.
one thing I forgot to mention earlier in preparation for a plane trip, I don't drink because I don't want to have to use the restroom on the plane. So I don't drink the day of travel. Yeah,
Wow.
it's not good for your health.
No, it's not. Wow. Thank you. So, Rich, I'm minding the time here. I know Lance is going to give me the hook here in a minute. Really quick, can you
Mhm.
just share just a little bit? Because I know we're going to talk some more about this
Yeah,
later.
certainly. I know, and Mr. Buckland's here as well to be able to
Yeah.
talk about these things. But I guess the quick summary is that this proposed rule is supposed to bring airports and airplanes to be designed with accessibility in mind. So everything from ramps, lifts, restrooms, and accommodations will have passengers with disabilities in mind. There's also training for airport personnel and the third-party contractors when they handle equipment or even somebody with disability that needs assistance. So those are the two summaries that I would, quick summaries of this rule.
Great.
There's a lot in there to comment on, and it is open for public comment. And so if you send in your comments to us, we will make sure that they make it to the Department of Transportation.
Thank you. Thank you, Katie, for spending your time with us. Thank you, Rich. Lance, I hope I'm not didn't run too long there.
Terrific conversation. Thank you,
Awesome.
Colony.
Thank you
Thank
both.
you, Rich. And thank you, Katie, for just sharing your stories, your wisdom, and just being a remarkable advocate for the ALS community. All right, before we go into the next part of our conversation, we wanted to share with you a brief video on this issue from a recent event at the White House. Enjoy.
We are assessing what transportation means in this country and the basic elemental fact that your daily routine, your relationship with the economy and with your family, all of it depends on your ability to get to where you need to be. And when somebody cannot travel because somebody else has decided that it's too hard to accommodate them, the world shrinks. And importantly, it shrinks for that would-be traveler, and it shrinks for everybody else. Everybody who would benefit from having that traveler with them, whether it is for a family gathering or whether it is for a board meeting. And we know that we can do better. Despite a lot of progress, transportation remains inaccessible for too many, and that is certainly true in aviation. I've heard so many stories from friends, from advocates, from many people in this room about injuries to damage to wheelchairs, injuries to people's dignity, and sometimes injuries to people's person as part of the travel experience. This community of advocates and community leaders who have helped make what in so many areas dating back to the gains that have been made through the ADA itself and the Air Carrier Access Act and everything done since have really helped transform what Americans believe is possible to get from things that seem impossible to things that are well understood and no one would have it any other way. So I'm thrilled to be here with advocates and public servants who worked so hard and for so long in advancing accessibility, to be here to officially announce our proposed rule on ensuring safe and accessible air travel. I'll just highlight a few high points. The first, the proposed rule requires much stronger training, annual training and practical training for staff who handle wheelchairs or physically lift people. Secondly, the proposed rule makes clear that damaging or delaying the return of a wheelchair is automatically a violation of the Air Carrier Access Act, making it subject to a fine. And a third point, the proposed rule requires airlines to provide passengers the option of using their preferred vendor to repair or replace their wheelchair if it gets damaged. This is the proposed rule. We think it's good because it reflects a lot of that input, but during this open comment period, we need to hear from the community. If the provisions look just right, please say so. If they need to be adjusted, if you think there need to be changes, please say so. That input is vital to getting this over the finish line and to changing experiences for so many air travelers around the country and ultimately around the world.
Certainly some encouraging comments from the Secretary of Transportation, Pete Buttigieg. I'd like to bring back on Colleen, as well as a special guest today, Kelly Buckland, who's the Disability Advisor in the Office of the Assistant Secretary on the Policy at the Department of Transportation. So some brief background on Kelly. Kelly Buckley is a person with a disability who has been actively involved in disability issues since 1979. Kelly started his career as an employee for Idaho's Protection and Advocacy System. He served for over 20 years as Executive Director of the Boise Independent Living Council, Living Independent Network Corporation, and the Idaho State Independent Living Council. Additionally, Kelly has a long history with the National Council on Independent Living and has served on numerous council legislative and advocacy subcommittees and other standing committees, as well as the governing board. Kelly is a respected and trusted advisor of Transportation Secretary Pete Buttigieg, and we are honored to have him here with us today. Colleen?
Thanks, Lance, and welcome, Kelly. Thank you so much for joining us today. I like that you're just casually hanging out with Mayor Pete there, you know, as he gives his talk. You obviously have a tremendous amount of experience and I appreciate all of your advocacy work. I know it's been a personal journey for you too, and the life that you've lived. I'm wondering, you know, given your work with the administration, if you could share with our guests really what the administration's commitment is to ensuring safe air travel for people that need extra assistance. I know this rule is addressing that, but I'm curious to what kind of the administration is focused on.
Yeah, thanks for having me. It's great to be here with you all. Hello from Washington, D.C. I'm in my office at the department headquarters. The lighting kind of sucks in this office, so I apologize for that.
That's okay.
But as you can tell, I'm an old cowboy from Idaho. Grew up on a potato farm and a cattle ranch. Had a diving accident at age 16. So I had a spinal cord injury. So that was in 1970. So I've spent 54 years in a wheelchair. So I've experienced a lot, especially the stuff that people were talking about before. Like, believe me, I've experienced all that stuff.
Yeah.
I've been flying though since I was 21. That was my first airplane ride, was when I was 21, which would have been 1975. So nobody on here is old enough to remember Hughes Air West, but Hughes Air West was one of the first airlines, and it was Howard Hughes that owned it and operated it. And the flying experience in 1975 was significantly better than it is today. It has deteriorated over the decades to where now it's like neither accessible or safe. People are actually putting their lives in jeopardy just boarding an airplane. So if that happened to an able-bodied person, the NTSB would be there doing a site visit and doing a report, an investigation. They would come out with recommendations to where it never happened again. But with us, that's not been the case. It actually just keeps getting worse. So President Biden appointed me to this position in September of 2021. So after I got here, I started working on a set of disability policy priorities. The first one was ensuring safe and accessible air travel. The second one was ensuring accessible public rights of way, including rail. And the third one was employment of people with disabilities. And then the fourth was around automated and electric vehicles. And one of those things was electric chargers. So we're also focused on making sure that electric chargers that are being put up around the country, because there's 500,000 of them in the bipartisan infrastructure law. But anyway, so in March of 21, we had a meeting of the disability community and the airline community. And I presented the policy priorities around air travel. And I got a resounding yeah, that's the right priorities. We should get started on. So there was about 1,000 people who attended that meeting in March of 2021. So those policy priorities then got put into a memo to the secretary, and he approved those policy priorities. And we announced that on July 26th, 2022, which was the anniversary of the ADA. So what's important for people to, I think, to understand is that the ADA governs airports, but airplanes and airlines are governed under the Air Carrier Access Act, which is much less comprehensive and significant. So the priorities around air travel were, one, we finalized a rule requiring accessible restrooms on single aisle aircraft, which is mostly domestic flights, right? So they're already required on international flights or wide body jets, but not single aisle aircraft. They are now. We published that rule in July of 2023. We also established a Passengers with Disabilities Bill of Rights. There's 10 rights in that Bill of Rights, and they're on the website. I would encourage you to look at those, the Bill of Rights, because they are already in effect. So if you know what your rights are, it's much easier for you to advocate that your rights are preserved and that your rights are provided when you're traveling in air. You know, Katie's experience is very similar to lots of people's experience. And our rough guess is that about 50% of people with disabilities have just stopped flying altogether. And I did that, especially during COVID. I mean, I wasn't going to fly on a plane because remember in COVID, there wasn't any masks required. You didn't have to be vaccinated. None of that. So when you get on an airplane, you're pretty well assured you're going to be sitting next to somebody with COVID without a mask on. You're going to be breathing it in. So I stopped flying for sure then, but I still only fly, even today, when I absolutely have no other choice. I mean, if I've actually driven across the United States to go back to Idaho because I did not want to get on an airplane.
Wow.
But the other thing that we did was we have tried to beef up enforcement of the current rules. So I know people were to the point where they filed a complaint and it felt like nothing ever happened with it. So they just sort of went into this abyss, and the department lost people's confidence that when they filed a complaint, anything was going to happen. So we've really tried to also beef up our current enforcement of the Air Carrier Access Act as it is. And the department has hired on 8 new attorneys to go through the backlog of complaints that we have. They've also reorganized the Consumer Protection Division and have now started like triaging complaints. So the most serious ones are the ones that we deal with first. And then we work our way through those, but we're starting to actually catch up with the backlog. Those 8 new attorneys, and we also hired some new analysts as well. So those have really helped us start to really address the backlog of complaints. But this rule that we announced in the end of February, that you saw the event at the White House, is sort of the pinnacle of our work, right? So this proposed rule does several things. The secretary named them off, so they're public, what they do, but one, they require training for people who handle you and or your chair. They have to have hands-on training. It has to be done when they are onboarded as a staff person, and then they have to have annual refreshers. And we're hoping that that training, or I am hoping that training can be done by a disability-led organization, so that they're knowledgeable about disability, they know how to deal with people with disabilities, and they know how to train people to listen to what the person is telling them to do in the directions. And instead of thinking they know better than the person with disabilities flying, what they need in order to board safely. So that's one of the things it does. It also makes violation or damage in your wheelchair or you an automatic violation of the Air Carrier Access Act. Then it also well, it also requires that the airlines return your chair promptly, quote unquote. What that means is when everybody else has deplaned and they're off the aircraft, your wheelchair should be waiting for you. They've got the time where people are deplaning to get your chair upstairs and down the jetway, waiting in front of the door for you. And then the other thing it does, as the secretary mentioned, is it also requires that you should be the one deciding which vendor you go to either replace or repair your wheelchair, instead of the airline telling you who you can use. So that's, there's a number of other things, but that's kind of the most significant and important ones. But you can see that this is one in a series of things that we've done to try to improve air travel. The other thing that we have done as well is in the bipartisan infrastructure law, there's $5 billion for what they call the airport terminal program. So, and disability issues are given a priority. So if we get a grant application for the terminal program and it has disability stuff in it, it's already prioritized and given extra points for just addressing disability things, which is like the ramps, the inner travel in the airport. It also looks at communication for people who are blind and deaf around air, gate changes or delays or cancellations, because a lot of times people don't get those announcements. And then we will be addressing in a future rulemaking communications for people who are deaf in air travel on the plane. But there's a lot of stuff in that airport terminal program too, and $5 billion is actually a lot of money. So
Yeah, it is.
it pays for pet relief areas, it pays for restroom modifications, adult changing tables, like lots of things we're doing to improve the airports and the air travel as we know, as people just voiced. And then finally, I'll just mention that we also started a research roadmap at FAA, and we're in the second year of that. It's a 3-year research roadmap. We're in the second year. The first year they did crash testing of wheelchairs to determine whether or not they are able to fly in an airplane safely. This second year, they're studying securement devices that will secure your plane or secure your wheelchair in the plane. And then during the third year, they're going to look at evacuation and the other amenities on a plane, like the oxygen masks and belting you into your wheelchair so that you're like everybody else is wearing a seatbelt. If you're in your chair, you're gonna have to too. But the whole point is to establish a wheelchair spot on airplanes so you don't have to get out of your wheelchair. No one has to handle you or your chair. You just drive on an airplane, lock in like you do every other form of transportation. Right? If you get in a cab, you get on a boat, you get on a train, you do not get out of your chair. Well, air travel should be the same way. And that's what the research is intended to do. So hopefully, it probably won't be during this term, but hopefully in the very near future, we will have a secured wheelchair spot on airplanes for people with disabilities who fly in their own chairs.
Wow.
And with that, I'll turn it back to you.
Well, that was everything. I mean, I was like going through my list here on the side and all my questions, and you answered them all, and actually gave me a lot more information. And thank you, because I learned some things. I didn't realize the difference in regulation between the airport and the airplanes. And I'm a very frequent traveler, and it makes sense to me now when I look at the differences as I look around. So thank you for all of your work. This is tremendous. I know our community wants to be a part of pushing not just the legislation forward, but even participating in that training that you were talking about. You know, because obviously that's a really, really key component of being able to train personnel on how to transfer people safely, and make sure that it's not just about getting the wheelchair there on time, but also getting people there in without any harm. So thank you. I see Lance. So Lance is giving us the hook politely, and stick around because I think there's still some more Q&A. So thank you, Mr. Buckland. It's a pleasure to meet you.
Yeah, and I just wanted to add, Colony, to
Yeah.
Mr. Buckland, who spoke so well about some of the recent provisions, these most current provisions. We got a lot of comments in the chat with respect to having the airlines perhaps reformatting or refitting so that people could drive their larger power wheelchairs onto the plane. So I'm really grateful that you spoke to that, and I think provided some level of optimism and encouragement to our community. So thank you so much for that.
Thank you.
So if
Go
I
ahead.
could, I'll just, if you haven't already, you should Google Delta's, what do they call it? Anyway, the Delta seat
Oh, I've
system.
seen it. Yeah.
So Delta has already developed a seat that folds up. You can back your wheelchair into the same spot.
Yep.
and lock down. They've submitted that seat to the FAA for certification, not the lockdown system, but the seat itself. So not only from the government side of stuff, but from the industry side of stuff too, we're making lots of progress toward having a wheelchair spot on airplanes. And if you haven't seen the Delta seat, I would really encourage you to go on the web and take a look at it, because then you're able to visualize how it would work. And it really does make it a simple thing. So anyway.
I'm glad you brought that up. I have seen that, and I'm with you. I encourage people to take a look and then check it out because it can be done. It's nice to see. So
Well, thank you both. As we promised, we're going to have some time for some more Q&A toward the end, so please stay close. But next up, I'd like to bring up my colleague, Dustin Pershaw, who's the Director of Advocacy Engagement and Mobilization, who's going to share some thoughts in terms of what you can do, all of us can do, to make sure that your voice is heard at the Department of Transportation. Dustin?
Amazing. Thank you, Lance. It's really, really great to be with you this afternoon. Lots and lots of great information. So thank you to Kelly and thank you to Katie. And so Danny, if we can go to the next slide, we want to make an advocacy impact. We need all of you. And so as was mentioned, there was the proposed rule and we want to be able to submit comments, and we are collecting those comments. So you can take action now. You can text FLY to 1-855-469-261 to get the action alert. You can scan that QR code, or you can go to that URL. I'm going to put it in the chat just now, and that will take you to our action alert that we have. And so these will be left up on the slides I have going forward. So don't feel like you have to scribble it down right now. But we are really wanting to get your feedback and be able to submit that to the Department of Transportation. Daniel, next slide, please. And so we recently launched Alert, and we had an overwhelming response from the community so far. We have over 60 stories from the states that you have here. Right now, Florida's leading the pack, followed by California, but you can see we have stories from across the country, but we need even more. We want stories from all 50 states, from folks from everywhere, even more from Florida, even more from California, from everywhere. We would like stories from folks to talk about their air travel stories, and they can range from all kinds of different things. So Daniel, next slide, please. And so you can see this is kind of a collection of what we've heard so far of some of the key words that you've had in there. So we have people talking about their chair and being transferred. We've heard folks talk about different nutritional assistance and, of course, damage to the chairs, things you've heard about today. But we want to hear from you. We want your feedback. We want your experience. We want to be able to pass that along in support of this new rule so they can be finalized. You've heard all the great things that we want to happen, and we want to move air travel forward to really improve for our community to come solve some of these issues. So next slide, please. So if you go to the alert link and you're on your laptop, it'll look somewhere like this. And you'll see there's a little box that says kind of share your travel comments here, and underneath tell your story. You simply just type them in there and hit submit, and then we will collect them. And so next slide, please. And so wait to come up. And so I'm going to share, just so you don't have to read all the stuff on the side. This just explains to you on the alert that we are collecting these comments to be shared with the Department of Transportation. We'll share your first name, your city, and your state with them. Our deadline is Thursday, May 9th, just so we can package them all up for folks. But these are some key questions that you may have about what, some people may be wondering, well, what can I share? What are some good feedback? If you've ever had your wheelchair lost or damaged while traveling, if you've experienced challenges getting your device repaired, if you've ever had to fly for medical treatment or for a clinical trial, or if it's ever impacted your treatment, we want to hear about that as well. And if you've ever been in a situation where airline employees need additional training for assisting a person living with ALS or their battery-powered assist devices, please share that information in as well so we can pass that along. So there's a lot of stories we had, and we need even more. So next slide, please. And so if you join by phone, this is what it looks just slightly different. So these are some screenshots of what it will look like on the phone. If you've never taken action with us before, you'll see it'll ask for your information, your first name, last name, and so on. There's also the option to sign up for our advocacy text alerts. You can, if you don't wish to sign those, you can still provide your number, but then just select no. And then we'll want to know your connection to ALS as well. Once you do that, next slide, please. You'll see that it just the comment box is just below. So you would scroll down just like it's just positioned slightly different on your phone. And then you would type in your comments there and hit submit. So it is mobile optimized so that you can enter your comments that way as well. So next slide, please. So one more time, we want to make sure that you are able to share your comments with us. So you can text FLY, F-L-Y, to 1-855-469-2621, and then a link will pop up on your phone. Scan that QR code, or go to the link that I put into the chat where, or the bit.ly/flightmares. There's a combination of flight nightmares for you all there. But we would really, really need your stories and your involvement to really kind of make a big impact with the Department of Transportation. So please join us in this campaign and share your experience, share your stories, so we can make big improvements for everyone from the ALS community. So with that, I'll go ahead and turn it back over to Lance, and I hope to see many, 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 many stories that we can pass on to folks. So thank you, guys.
Excellent. Thank you, Dustin. And if I could have our previous presenters, Colleen, Kelly, Rich, if you could join me for this Q&A. We just have a few comments. And again, we encourage you to post any additional questions into the chat. But we did have a few that we just wanted to kind of present specifically more to, I think, Rich and Kelly with respect to what the agency will be able to do. We had one person ask with respect to remedies, is to what extent it would and supply a loaner within a 4-hour period.
Can you repeat that?
I can. There was a recommendation, and I'll also pose that as a request, that laws be made that airlines pay for all repairs that may occur from a mishandling of a wheelchair and supply a loaner to that person within 4 hours. Is there any chance for that to be a provision in some of the things that you are contemplating, Kelly?
It's already required.
Oh, great. Okay.
They are required to replace your wheelchair or repair it up to the original purchase price. So unlike luggage, there's not a limit on it. The limit is what the original purchase price of your chair was. So if you paid 50,000 for your chair or 75,000, that's the amount that they have to provide up to repair your chair. And they are supposed to get you a loaner immediately. What that means is, like, depending on the vendors, because if you're landing in an airport that's in like Little Rock, Arkansas, like I'm not sure that they're going to have a vendor that's going to run out to you at midnight. So it depends on time of day and what airport you're at, how quickly you're going to get a loaner chair, I think.
And Kelly did a terrific job of describing essentially what the current provisions are and what's being proposed. But we did have a question, not just as it relates to access to the power wheelchair onto the airplane, but actually accommodations for the toilets for those that are living, and perhaps what accommodations or retrofitting are going to be done as it relates to people having a comfortable place to do that work.
So the accessible laboratory rule that we passed and made final requires that the restrooms be large enough for you to be able to go into it with the onboard wheelchair, which means not your chair, but the one that the airline has available on the plane, which I don't know if you all know this, but they are required to have an onboard wheelchair so you can use it to go to the restroom. And then the flight attendants are required to help you get onto the onboard wheelchair, get it out for you, help you get on it, and help you to the restroom. They're not required to help you go to the restroom. They're required to get you to the restroom. And then the rule that we passed also requires that the interior amenities inside the restroom be made accessible. So like the faucet handles, the paper towels, all those things are going to have to change so that they're accessible. And they'll have to like put an emblem on the restroom saying it's accessible. But making the restroom larger doesn't happen for 10 years. That was a compromise with the airlines to make the restrooms more accessible, but they're required now to have a restroom large enough for you to take the onboard wheelchair in. In 10 years, the restroom's supposed to be large enough for you to be able to take the onboard wheelchair in with another person to assist you. So it's going to have to be large enough for you and your assistant. So, but that, like I say, that's not for 10 years. But anyway, those are the sort of provisions that are in there. Now, being able to take your wheelchair into the restroom probably won't happen in my lifetime. It's just something that's going to be down the road. But trains that we're replacing all of the Amtrak trains, by the way. So the new train cars, the restrooms are huge. I mean, you can turn your chair around in them. Like they're that large. They have automatic doors. They have adult changing tables inside of them. So that, I mean, the restrooms that we're going to have on the trains, and the trains themselves are going to be so much more accessible. They'll actually, I think, rival airlines for people with disabilities who want to travel. I think train travel may be something people choose to do. It's going to take longer, but it's going to be a lot more comfortable and more accessible. So.
Thank you so much, Kelly. I don't see any other comments or questions in the chat. We do appreciate everybody adding their voice to this conversation and taking the time to be a part of this conversation. We want to thank all of you for being here, for participating in this. And I think the key call to action for all of us is to do those things that Dustin asked us to do and add our voices to this very important issue. So again, thank you to all of our guests. Kelly Buckland, Katie Adams, thank you, Rich and Colleen, Dustin, for participating, and we look forward to seeing you at our next webinar. Again, thank you for taking action on this very, very important issue. Have a great day.